We're here at Stanton High School today, and we're going to be meeting with a physical therapist from Faith Regional to talk about a topic that's been very popular in recent years, and that's concussions in sports. I'm joined here by Tony Garcia, and Tony, we're going to be talking today about a topic that's a little bit taboo. It's concussions, and I feel like until recent years, people didn't really like to talk about them.
Yep, so that's a newer area in the world of sports medicine. You know, it's very involved. It affects us at the acute level, how we treat them on the sidelines, where they need to be referred to, and then get them back into full sport.
Now, I feel like historically the treatment for concussions was kind of just wait it out, avoid bright lights. But now there's rehabilitation for it. Can you kind of walk us through that?
Yeah, so the biggest thing is if the whole mentality of rest and wait it out typically takes longer as far as rehabilitating from a concussion, most of the research shows that we want to be more active in our approach and progress them based on what they can handle. So as far as concussion treatment in itself would be, number one, we'd have to diagnose it, whether it's being seen on the sideline, holding the kid out. You know, sometimes they get referred to their primary care providers if needed, and then we get them into the clinic to treat them with myself or with the athletic trainers, depending on what they need.
Is there kind of a set timeline of how long it takes, or does it vary by injury?
It does vary. Most of the data shows that 80 to 90% of concussions resolve in 2 weeks. Aside from that, though, that's usually when I come into the picture. If they're having any kind of deficits, I'll evaluate them and figure out what's not working and what kind of a treatment plan we need to put together to help them get past that concussion.
Now, a lot of student athletes are eager and even anxious to get back out on the field or on the court or back into their activity. How good are these tests at making sure they don't come back too soon?
So the biggest thing is we utilize these tests to make sure that we rule in the concussion properly. There are newer tests that are coming out, such as the VOMS assessment, that helps us identify nonverbal indicators to help rule in and rule out the concussion. We can look at their subjective change, so what they feel is changing, to help us identify the concussion. But just to make sure we're accurate, we try to use more objective-based tests to rule in or rule out that concussion safely.
Well, I appreciate you taking time to talk to us and helping us and the viewers better understand the magnitude of concussions and just get a better understanding of what they mean and how bad and dangerous they can be.